Welcome all to our webinar today on how has Nigeria responded to the gendered impacts of COVID-19. My name is Rosemary Morgan. I am a research or associate scientist at Johns Hopkins Bloomberg School of Public Health in the Health Systems Department, and I am delighted to be here today to start off this webinar and introduce our panelists and our topic today. So this topic is, we are presenting on behalf of the Gender and COVID-19 Project. So the Gender and COVID-19 Project is really focused on understanding and mitigating real-time differential gendered effects of the COVID-19 outbreak. It's a comparative case study across a number of countries, as you can see there. And we're excited to share some findings from Nigeria specifically today. The program is supported by the Bill and Melinda Gates Foundation, as well as the Canadian Institute for Health Research. A quick note, as part of the Gender and COVID Working Group or project, we also have the Gender and COVID Working Group, which is welcome to, anyone is welcome to join. We meet online on the third Wednesday of every month to discuss key activities, key issues, activities, opportunities, and ideas for collaboration. And we have a long and growing list of resources on gender and COVID-19. You can visit our website to see those resources, as well as to join the working group. Just a little bit of housekeeping before we start our official program. This event is being recorded and will be available on the Gender and COVID-19 website. If you have any questions, please make sure to type them into the Q&A function. If you can, state your name and affiliation in case of your question, and ahead of your question, as well as your location. So we are keen to hear from a variety of locations to enrich our discussion today. Do try to keep your questions brief. Don't worry at all about spelling. The act of contributing is much more highly valued than the art of spelling, and you can post your questions anonymously if you would like to. So live closed captioning is available. You turn it on by clicking closed caption button at the bottom of the screen. You can also do that to turn it off, the subtitles, if you find that they're on. Please do email us if you have any follow-up questions or points, and you can also follow us on Twitter and make sure to tag us in any tweets about the event. So why are we here today? Well, we are here today because of the gendered impacts of COVID-19. We know that men, women, and gender minorities are differentially and disproportionately impacted. And they're impacted in different ways in relation to economic, social, security, and health effects related to both biological sex and gender. And we know also that measures to mitigate the gendered impacts of COVID-19 should be part of the pandemic response and recovery plans because of these differential impacts, but more often than not, they are not. A lot of global policy created to respond to the outbreaks is gender neutral, meaning that it's not considering or even thinking about these differential outbreaks. And a lot of outbreak responses are consistently failing to meaningfully include gender analysis. As part of the Gender and COVID-19 project, we have developed a brief to help countries and governments, as well as organizations, to think about how to create a gender responsive pandemic plan, particularly in relation to addressing the secondary effects of COVID-19, which I'll go into in just a moment. You can visit the website to see this plan, which includes some key steps and key considerations that should be incorporated. What is a gender responsive pandemic plan? Well, it is one which takes into consideration the intersectional needs of men, women, and gender minorities in the planning, data collection, response, and recovery efforts. And this includes considering and addressing how women, men, and gender minorities experience differential primary short-term and secondary long-term social, economic, security, and health impacts. Here today, we're specifically here today to talk about how Nigeria has responded to the gendered impacts of COVID-19. We have conducted an analysis as part of the Gender and COVID-19 project. We're also currently conducting primary research and analyzing that research in Nigeria. And this report specifically analyzes the gender responsiveness of Nigeria's COVID-19 plan by asking, how has the COVID-19 pandemic impacted women and vulnerable groups in Nigeria? What measures were included in the Nigeria's national COVID-19 pandemic multi-sectoral response plan to specifically address the gendered impacts of COVID-19? What measures have been taken to address and respond to the gendered impacts of COVID-19 in Nigeria? And what else can be done to ensure a gender responsive pandemic plan? So what is in the report? Well, the report covers both the primary and secondary gendered impacts of COVID-19. By primary impacts, we mean the more immediate direct impacts such as COVID-19 infections, vaccinations, deaths, and related illnesses, while secondary impacts refer to longer term social, economic, and non-COVID-19 related health impacts, which may be as a result of COVID-19, but also measures to address COVID-19. And the report outlines the measures taken by the Nigerian government and recommends how to strengthen these interventions by introducing a gender lens. And we were going to go into that specifically today. Just a quick note about our methods. We conducted a desk review, looked at government publications, reports, academic journals, news and web articles to prepare this brief. And as I mentioned, we also are currently conducting primary research, which will also feed into this work. So who are our speakers today? I am delighted to introduce Patience Agada, Hangli Tan, and Amy Oyekunle. So Patience Agada. Patience is a graduate researcher with over 5 years of experience working on gender, sexual and reproductive health, and nutrition in Nigeria. She presently works with Moni Development Consults, where she supports the Gender and COVID-19 project. She is passionate about expanding access for women and girls, especially vulnerable and marginalized groups, to comprehensive health, social, and economic livelihoods. Hangli Tan is an MPH candidate at the Johns Hopkins Bloomberg School of Public Health. Prior to pursuing an MPH, she served as the head of campaigns at the Women's Aid Organization in Malaysia, where she advocated for policy reforms related to gender-based violence and gender equality. She is particularly interested in bringing a gender lens to health systems and policies. Amy Oyekunle is a gender and development professional with over 15 years experience in gender-based violence, adolescent girls, feminist and gender research, women's peace, and security in Nigeria. She is the CEO of Moni Development Consult, a research and project management organization providing short and long-term technical assistance in Nigeria. She has worked with the Foreign and Commonwealth Office, UN Women, Federal Ministry of Women Affairs, International Alert, Save the Children, the British Council, Water Aid, and Sahel Consulting and Nutrition. Amy has a master's degree in development studies from the University of Leeds, United Kingdom, and a Bachelor of Science in Sociology from Ahmadu Bello University in Zaria. So without further ado, let us hand over to our panelists. I will just give me a moment while I share the screen. And then we will hand it over. Okay. Patience, over to you.
Okay, thank you, Rosemary, and welcome everyone once again to this webinar. To start off this discussion, I'll be speaking first around the Nigerian COVID-19 response plan, which is also known as the National COVID-19 Pandemic Multi-Sectoral Response Plan. This plan was released by the Nigerian federal government on the 18th of May 2020 and outlined the roles of the different sectors of the government during the 6 phases of the pandemic. Looking through this plan, what we see is that it focuses on preventing, containing, and mitigating the COVID-19 infections, as well as addressing the social economic impact of the pandemic through provision of palliatives and aids. But what we don't see is that what would again see rather is that it does not specifically mention women or gender. It does not take into consideration the intersectional needs of women and girls, and it's more of a one-size-fits-all plan. At the aim of the coordination of this response plan in the response towards COVID-19 pandemic in Nigeria is the Presidential Task Force, a 12-member committee that was established on the 9th of March 2020. But following the expiration of its tenure, it's been transitioned rather to the Presidential Steering Committee, which is what we have now. And this Presidential Steering Committee has a more modified mandate to reflect the longer term nature of the COVID-19. Next slide, please. Okay, speaking to the primary impact of the pandemic so far, quoting data from Global Health 50/50, as at 8 August 2021, men comprises of about 60% of the confirmed cases and about 71% of the death cases. And men with confirmed COVID-19 diagnosis are about 60% chances more likely to die compared to women. This may be attributed to their health-seeking behavior. There is also an evidence which suggests that men are less likely to engage in preventive measures, such as the use of hand sanitizers, nose masks, as well as social distancing. Presently, there are no publicly available sex disaggregated data on COVID-19 testing, vaccination, hospitalization, and even intensive care unit admission. And so we don't know if enough women are getting tested. We don't know if access to vaccination is being hindered for women as well. And this data is needed to influence public health decisions to promote gender equality. Next slide, please. Okay, to speak to livelihood and social protection, generally in Nigeria, we have over 80.4% of people, workers in the informal sector. I'm bringing it down to the Nigerian women. About 90% of the Nigerian women are in the informal sector, and for most of them, they have little to no social protection and even buffers for situations such as an outbreak or even a pandemic. And what we've seen is that the lockdown and even closures of markets have further impacted on their income and threatened the survival of their small businesses, for which most of them don't have cash reserve or even insurance. Even at the point where the lockdown was facing out, where they could access their business on alternative days, you can't compare what they make on a daily basis from those days they were able to go to the market to when they had access on daily basis to their businesses. In terms of assistance, the government have tried to cushion the effect of the pandemic on businesses by trying to support people. But what we've seen so far is that most of these interventions are largely targeted at the formal sector, where we have just about 10% of the Nigerian women. And another thing is that during the lockdown, for male-dominated occupations such as carpentry, motor repairs, and other form of other occupations that are dominated by men, due to the fact that these businesses were not classified as essential services, these businesses were actually affected. And at that point, most women within household were pushed to step up to become sole breadwinners when their partners lose their job. And also for some women, just to ensure that there's some form of food security within the household, they've had to take up additional tasks, additional businesses, or additional way to support food within the household by starting up small-scale farming. And for some, they've gone as far as dipping their hands into their business capital and have even resorted to selling off some of their assets, such as gold. Can we move to the next slide? Thank you. Looking at this graph, it shows it's from a survey that was carried out in 9 states in Nigeria, including the Federal Capital Territory, where women were asked about if they actually got some form of palliative or aid. And looking at it, we have a huge chunk, about 79% saying that they had no access to palliatives of any sort. The other 21% goes to is where rather we have women who had access to food, about 16%, masks and sanitizers, 4%, and for cash, just 1%. And what this translates to is that for some of them, or what are the reason we could actually attribute to this? For some, on the internet, rather, we saw some of these places where this distribution of these palliatives actually happened, and what we saw was long queues. And for these women, they have to decide whether they want to stay on these queues for unending hours or sit back at home to support their family, take care of their kids, get engaged in unpaid labor, or even ensuring that for their kids that have to do this online school, they are able to support them. And from this survey, some of the women that were interviewed actually described some of these palliatives as mere token. And really, from some that we also saw on the internet, especially when you come to the food aid, some of this support was for a family of about, for a household of about 4 persons, this food supply in terms of palliative may not support this household for more than a day or two. Next slide, please. Oh, speaking to education, prior to the pandemic, Nigeria had the highest number of out-of-school children. Over 10 million children in Nigeria were out of school before the pandemic, of which about 6 million were girls. The school closures due to the COVID pandemic has further affected over 18 million female learners, further exacerbating pre-existing educational inequalities. In a survey carried out by Care International in 2020, where about 308 adolescents were interviewed, aside from the fact that because of the school closure, they have to stay at home, other reasons that were stated include decreased household income, the fact that they have to take up extra domestic labor just to meet up with supporting the family. And because of the decreased household income, most families have to prioritize food over education. And even aside from that, within the household, because of the social and cultural norms that still exist in Nigeria, some families actually prioritize having the male children having access to this education than the female child. So girls who are out of school also are at increased risk of sexual coercion, teenage pregnancies, and child marriage. Even though there are no data to support this for Nigeria, neighboring countries such as Kenya, Uganda, and Malawi have reported spikes in teenage pregnancies. In terms of child marriage is quite predominant in Nigeria, especially the northern part of the country, where we have about 40% of girls, where about 44% of girls are married off before they get to the age of 18. So during the pandemic, there were actually reports of parents marrying off their daughter just to be able to feed the rest of the family, or because they couldn't even feed them. During this pandemic as well, poor families have been disproportionately affected. One of the ways that the government have tried to cushion the effect of the pandemic on education was providing access to digital learning platform, ensuring that learning platforms were available also, or learning programs were available on radio and television. But then again, there are factors that actually may hinder access to these services. One of them is the epileptic power supply that is still quite common in Nigeria. And then for accessing digital learning platform, most families too have to also consider, do they want to spend money on data subscription or spend money on other things that which may be a priority to them. So at this point, I would hand over to Angli to continue this conversation. Thank you.
Women are at the front line of the pandemic response, as they comprise about 60% of the health workforce in Nigeria. And women also are overrepresented in health occupations that have high patient contact, such as nursing, and this increases the exposure to COVID-19. And healthcare workers have experienced a mental health toll during the pandemic. They have had to work extra shifts. They have had less time with family, and some were even forced to be in isolation facilities. And many healthcare workers were also expected by their family and friends to provide care and advice informally outside of their work hours. And all these, leads to increased stress and burden on healthcare workers. And at the same time, many health workers also face stigma from the community. For example, during the lockdown, some healthcare workers were dropped home in ambulances due to movement restrictions. And when community members saw them in ambulances, they thought that they had COVID and therefore shunned them. And although healthcare workers have faced such a huge mental health toll and have also risked their lives to battle the pandemic, they were not adequately supported or compensated. And in fact, many healthcare workers have gone on strike several times during the pandemic. And last year, a union representing non-physician healthcare workers, such as nurses, midwives, and radiologists, went on a strike to demand for life insurance, changes to pay structures, as well as adequate PPE. And what is especially concerning is that despite it being a pandemic, in June 2020, the Nigerian government announced a plan to cut its primary healthcare budget by 43%. And this was reportedly due to shrinking oil revenues as well as the economic fallout of the pandemic. And all these could further worsen the working conditions for healthcare workers. Next slide, please. And during the lockdown, we have seen a huge spike in gender-based violence. In areas that were under full lockdown, reports of gender-based violence quadrupled. And this does not include the many cases that go unreported in Nigeria. And in fact, during the pandemic, several female students were raped and murdered. And this sparked nationwide protests. And in June 2020, in response to these high-profile cases of women who were raped and murdered, the Nigerian Governors Forum declared a state of emergency on sexual and gender-based violence. And as part of the emergency response, the governors called on states to set up sex offender registries, as well as to domesticate the Violence Against Persons Act. And it is worth noting that, amid the rise in gender-based violence, many shelters and one-stop centers in Nigeria were forced to close or to scale back their services due to COVID-19 restrictions, as well as inadequate PPE. And their services were not initially recognized as essential services. And this only changed following pressure from the public. Next slide, please. And, despite women being on the front line of the pandemic response, they are greatly underrepresented in COVID-19 leadership. Women comprise only 2 out of 12 presidential task force members. And women's participation in decision-making at the community level has also dropped during the pandemic. And this could be due to movement restrictions, a fear of sexual harassment by security forces, needing to obtain their husband's permission to leave the house during the lockdown, as well as increased domestic work. And women are also underrepresented in media coverage on COVID-19, despite being on the front line of the pandemic response. And analysis of COVID-19 news articles in Nigeria found that men were quoted nearly 5 times more frequently than women. And women were featured less in COVID-19 news compared to non-COVID-19 news. So as a whole, we are seeing that women are at the front lines in the COVID-19 response, but they are really underrepresented in leadership and decision making. Okay, so now I'm gonna hand it over to Amy.
Thank you, Hanli. Welcome, everyone. First and foremost, I just want to commend the brief because, I mean, not only because of Nigeria and I was part of it, but it was really, as a tool, it was really important to see and analyze what the government's response was, what the government has done or is doing with regards to responding to the pandemic, which everyone, I'm sure everyone represented on this platform, our countries had such an experience. So in terms of recommendations, I would like to say that the brief is really, it provides a wide array of recommendations according to thematic areas. And what was presented here today by Patience and Hang Lee is just maybe just 4 of the thematic areas. There are more thematic areas that are recorded in the brief. However, in speaking about recommendations, I will speak to what was presented today. So what we see first and foremost is what is critical and important in terms of recommendations is the need to develop a gender responsive pandemic response plan. And I'm happy to say the Gender and COVID-19 team has done a wonderful job of providing a plan, what a plan entails. A plan for this particular gender response plan would look at what you need to do as a country, as a government, before a pandemic, during a pandemic, and post-pandemic. It looks at things from an intersectional lens, intersectional points of view. It provides a need for a gender analysis to see what are the different areas where are women and men, boys and girls going to be affected, to enable a government to be able to adequately plan for that. Now that is critical because policymakers need to take into consideration those needs. It encourages a sex disaggregated data, which is critical for planning, whether we're in a pandemic or post-pandemic. The second recommendation I would say that is critical and important is investing in a gender responsive social protection structure and mechanism across all the states. When we did the research for the gender and COVID-19 last year, it started last year and went up until April. One of the things that we found, which patients alluded to, was women occupied a large chunk of the informal sector. So they were the market women. They were the women that sold tomatoes by the roadside. They sold provisions in stores. They sold secondhand clothes. And many of them had to close their shops. They had to risk security agencies. Many of them had their goods confiscated and destroyed. And even in the government's response, in the government's provided, and our government did provide, they provided what they called a SME response to the pandemic sometime in April and May, June. And they had women, bringing their pots and pans and proving that they are artisans or proving that they actually need it. And that was for me as a gender specialist, that was not an adequate response. What women eventually got, those that got money got about 30,000, which was pittance compared to what they needed. And so part of the challenge was inadequate social protection to protect women in the informal market. And in situations where they actually did provide some of this response in terms of money, it was mostly to artisans, which were occupied again by men. So mechanics, plumbers, it took the intervention of women's organization to say, hang on, you have women in this sector, and our government's response was, where are the women? We can't find them. Which brings me to the next point of ensuring that when we we have a register for social protection that captures adequately the names, households, women's workers, to be able to connect them to the needs or to the support and measures that they require. One of the questions that we asked when we were doing our research to Lagos State, and I should be clear that our research was specifically for Lagos State, was how did you give out these palliatives? How did you, during the COVID pandemic, how did you distribute? How did you reach women? And they agreed that, yes, their register was incomplete. They agreed that, yes, they have a long way to go. And how they did reach out to women was through support structures. So through churches, mosques, private individuals, which in itself was very inadequate because there were people that were receiving palliatives that didn't need it. And those that really needed it didn't get it. So it's important that, you know, we improve the structures, our government improves the structures to be able to connect them to private sector, like the COVID private sector that was really involved in giving out palliatives and distribution. And this links very closely to the issue of improving access to bank accounts and digital literacy. Next slide, please. So in terms of education, of course, Nigeria, when it comes to education, there's still a long way to go. However, there were some improvements in terms of education. But having said that, it still blindsided, you know, Nigerians when it came to the pandemic and the lockdown. Many private schools sectors were floundering, and they managed to get, okay, children should stay at home and remote learning, computers, but particularly for poorer and conflict-prone settings, it was a challenge. It was a challenge because of issues of internet access, electricity, and so on. So a recommendation would be to, you know, increase access to education by increasing investments for these communities, for public schools. Most of these public schools have moderate to very, very poor infrastructures in the first place, talk less of internet access. And so a lot of organizations have come together to say, consider solar system or a way of learning that provides for children in public schools to be able to access education, even in the throes of a pandemic. So invest in systems and structures that are conducive and that create an enabling environment for education across the state. Part of what needs to also be included from a gender responsive point of view is to ensure that there is more training for teachers and volunteers and people that ensure that there's online safety and safeguarding for children and adults. This is really important and critical. And a final recommendation on that would be to tailor alternative learning for girls' participation, to ensure that there's a way that, especially for girls, going back to school in these areas that I spoke about, it's a nightmare. So ensure that there is adequate compensation, so that you can increase participation and retention. Next slide, please. Hanli talked about how it was for the health workforce in terms of the trauma that they experience. A lot of them experience stigma, a lot of them even themselves were mentally affected. So a critical issue is protect the mental and physical health of health workers by addressing workplace health and safety. In Nigeria, mental health is it has always been on the back burner. Nigerians, we don't like to think that we have mental health issues because mental health symbolizes something else in my context. But it is something that, especially during the pandemic, it came out to the fore because during the pandemic, we also had the NSAS saga. And so the mental health is on the front burner, and more it has been something that is being mainstreamed in the health workforce. So it's critical and important that the government takes role of that, and not just government, but organizations, donors, and civil society look at including that in aspects of their work. Prioritize salary improvement and government structures to promote gender equality. You would think that with the pandemic that this would be a priority. I wish I could say it was. Not yet, but it should be, and I hope it will be. A lot of the challenges that was had during the pandemic was access to PPE, inferior materials that were being provided, or hoarding of materials in terms of providing this. They hoarded them in workplaces or and eventually during the NSAS, it was part of the things that were raided. So there's a lot of restructuring that needs to be done when it comes to healthcare and the health workforce in Nigeria, particularly to prepare for post-pandemic or even another pandemic. I mean, it's a country that we have had Ebola, Lassa fever, we're in the throes of the COVID-19, it still hasn't left us. So it's a continuous process. Part of what the government is doing, especially the government of Lagos State, is looking at health insurance. It's still a work in progress where they are getting people and companies to register, private sector to register their employees to provide health insurance. I will let you know how that goes as time goes on. Next slide, please. Finally, the recommendation around women's representation and participation and representation. But before I come to this particular recommendation, I think that what is critical and important is to talk about the gender-based violence that Hanli spoke about. We have had some progress in terms of that, and she mentioned about the state of emergency by the government. She mentioned also about the what it has done, and I'm happy to say that since the state of emergency last year till date, there has been an increase in the number of sexual assault referral centers across several states in Nigeria. There has been an increase in the number of states that have passed the violence against persons prohibition. Now we can say, yay, we can be happy about that, but probably one of the biggest challenge with gender-based violence is implementation and adequate budgetary allocations for activities around that. And of course, clearly making gender-based violence or organizations and institutions, particularly women-based organizations, recognizing their work and making it an essential service, even during a pandemic, post-pandemic. So that is a recommendation that is critical and important, which leads me to the last recommendation of ensuring gender parity in participation. Even though they had the presidential committee, we had very few, I think it was 2 women, eventually it went to 3 women that were part of that body. And it's a reflection of the larger framework in Nigeria in terms of women's representation. And so a critical recommendation is to ensure that 35% of representation or parity, and to address power relations within these institutions. But I will say that ultimately, it's important for government and all stakeholders, donors, development partners, women's organizations, women's groups, to pay attention to the importance of women's organizations. During the pandemic, they were my heroes. They did a lot of women-led organizations, women's-focused organizations took up providing palliatives, providing counseling, opening their homes for a lot of survivors of violence, and even people that had COVID-19, but it hasn't really been recognized or acknowledged, and it's critical for to ensure that, you know, women are recognized, not only recognized, but for the sustainability of any plan, of any pandemic plan, that they are involved in an inclusive and participatory way, that they are consulted as stakeholders, and that their input is really, you know, it's not something to say we just want to tick a box and checklist, but it's really accredited that women's organizations were able to do that, and to provide long-term funding to support the work that they do already. So I would like to stop there in terms of the recommendations and encourage everyone that the brief, it's a wonderful brief that is really a short read, and it is provided on the website, the address is there for you to have a go. We're interested in your feedback, but more importantly, in Nigeria, my team and I, and across the Gender and COVID-19 project with other countries, looking for how to use this to engage with stakeholders. So in government, I'm happy to say that the Lagos State government, when we were doing our research, we're very interested, particularly in the context of building back. And so it is a tool that we are using at this point in time to engage government and other stakeholders. So thank you. I open the floor for questions. Thank you.
Thank you, Amy and Hung Lee and Patience. I'm going to stop sharing the slides as we move into our question and answer. So please do use the question and answer function if you'd like to ask our panelists any questions. We do have some questions coming in. Yes, we will. I just see a question from Rohini about sharing the link to the brief in the chat box. We will do that. And yes, the presentation and recording will be made available. It will be sent out to all who registered, but it'll also be posted on the Gender and COVID-19 website once available. So we have a question from Isabel Carbonio, particularly about sort of the aid palliatives. They asked, what are the options for getting aid/support via mobile or e-vouchers that could be collected or redeemed at a local shop and when convenient for women? Amy, I think I will pass that question over to you.
Okay, thank you. At the moment, e-vouchers are being used, but not for what Isabella talked about. They are being used to transfer money if you want to send money to someone else. No one has explored, well, a few companies, private sector, are exploring the use of using e-vouchers for aid. So for example, the way it works is if I want to send money to someone in another state where they don't want to go to the bank, I send money through, I buy MTN or any other voucher, and they go to a shop and redeem it and collect the cash. We haven't looked at using it to buy or purchase something in a shop, but that is a really good point, Isabella, and I think that is something that needs to be explored a little bit more, but it is possible and workable.
Thank you. Thanks, Amy. So Peter Baker asks, first he says, thanks for the excellent presentations. And then he asks, do the speakers have any suggestions about what could be done to address the disproportionately high incidence and mortality in men and in men's role as vectors of the virus? Would male-targeted health promotion activities be helpful? And Peter Baker is from the Global Action on Men's Health. Would anyone like to take that question?
I think I would, Hanli, do you want to answer?
Yes, so I think it would be important to have targeted health promotion activities targeted at men to encourage preventive behaviors as well as early testing and treatment for COVID-19. In terms of vaccination, there isn't any sex disaggregated data, so we are unsure whether men or women are getting vaccines at higher rates. But given the higher numbers of cases and deaths among men, there could also be targeted health promotion activities for men to encourage vaccinations. Well,
in the way the government has responded to COVID-19 in Nigeria, it was gender neutral. Believe it or not, they said, I think there were efforts in the beginning of the pandemic, engagement with the Ministry of Health to say, you need to look at it from a gender point of view. And our minister came back to say COVID-19 recognizes no sex. I think the beginning is the disaggregation of the data for them to be able to understand and recognize that this is what the data is saying. The data that was provided for this presentation was gotten from a different website, not Nigerian. That's number one. And getting government to understand that this is how it affects, that when you go to primary healthcare facilities, or even when they're talking about health, because they don't understand the data, there's no special target for, let's focus on men and help them to understand how this is affecting them, and help them to have, Hanley, what did you call it? Appropriate behavior, preventive appropriate behavior, for them to be able to say, we shouldn't expose ourselves, we shouldn't, and things like that, for them to be able to adapt their behavior. And more importantly, for them to, take the vaccine. What we did find in our research is that many women, religion has a big role to play in terms of how people expose themselves to the vaccines or took the vaccines. And again, women would defer to, my husband. If my husband doesn't tell me to take the vaccine, I don't want to take it, or I don't want to take it. Decisions are made in that way. So I think that this is something that we would bring, I think, as advocates to the knowledge of the Ministry of Health and the NCDC, just so that they understand and get them to begin to look at the data. What is the data saying? To be able to develop those sex-specific adverts and campaign.
Great, thank you. Just a quick question from Jennifer Piscopo from Occidental College in Los Angeles. She asked, would it be possible to share the links to the government's plan and the recommendations in the chat? So I did share the link to the brief that has the recommendations. And Lee, would you be able to share the link to the Nigerian plan? Thank you. So we have some other great questions. Thinking about the order here. We've got a question about the tool itself, the Gender Responsive Pandemic Plan tool, and asking if we can talk more about the tool. Amy, I know you did talk a little bit about it, so I might throw this to you first to see if you can elaborate on the tool, about how to create a gender responsive pandemic plan and how can other countries use it, and then allow patients to come in and Hanley.
Well, I should throw it back to you, Rosemary. You know so much about the plan, so, and I have a bit of noise here, but the tool is, and I apologize, we have light, this is Nigeria. The tool is what the tool did was the tool looked at different thematic areas that is necessary and required for any plan, any agency, government, NGOs to look at and to say, what is it that we're trying to achieve or accomplish? And it looked at, from a gender analysis lens, what do we do pre, during, and post pandemic? And this is what I loved about the tool, that it took and broke down these elements so that if you are developing your plan, that you're able to say, where are the sectors that I need to look at? How does it affect women? How does it affect men? And better create your own plan. So I think that the tool in itself, simple as it is something that everyone should read and everyone should be able to prefer it. So it's not just for government, it's for civil society themselves, in terms of also making our case for government to be able to say, what are we going to, government, what should you be looking at when you are talking about a pandemic response plan? Rosemary, you are part of the team, and Hanley, so.
Yes, Hanley, did you want to add anything to that? No. Just a quick thing, I think that was great. That was really great, Amy. A quick thing is we also have a new tool going to be put on the website soon that is an indicator list that is accompanying the pandemic response plan. So the plan itself, as Amy said, as broad categories, particularly related to the secondary impacts. We actually are working on a similar brief focusing on the primary impacts that are more the direct and immediate. But then the indicator list provides sort of indicators that governments and organizations can use to help measure against these particular targets. So it's not an exhaustive list, but meant to be to get people thinking about how they can actually measure it. So our next question is from Rohini Pandey, and Patience, I might put this to you first. So Rohini is from the World Bank, working with the bank's RUDES Preparedness and Response Program, which also includes Nigeria. Their question is that in your efforts to advocate with the government to move towards gender responsiveness and preparedness, have you been able to also advocate to donors funding preparedness and response plans that are gender neutral to date to change their protocols? I don't know, Patience, I'll pass this to you first to think about it in the Nigerian context, and then maybe allow Amy or Hung Lee to come in as well.
What I want to say is what we've done so far is trying to engage high-level stakeholders with what we found out, as well as civil societies, to see how they can actually put in the findings from our research so far and from other findings into their scope to ensure that whatever they are doing is taking into cognizance the gender aspect.
Yeah,
Great, thanks.
I will add to that to say most of the donors that we have engaged, UN Women, International Alert, I mean, most of the people that I've worked with, their pandemic response plan or action aid has even essentially just focused on women. I mean, more women than men, but has looked at GBV. A lot of people during the pandemic were focusing on providing palliatives and support for women, for beneficiaries of programs. So they were quickly, change their plans and change their thinking. Oh, don't do this program anymore. Let's support girls. If we're doing an education program, how can we support the beneficiaries? It is a good point, Rohini, to say, moving forward in terms of how do they become more responsive. So I think that it's something that, as Patience alluded to, in the high-level meeting that we're looking at, which this is a Gates-funded project, and we're hoping that they would lead in terms of pulling together different donors that came together to support responses during COVID-19, including the UN Women, to be able to bring this to the fore. So it is a work in progress, I would say.
Thanks, Amy. So the next question is from Elizabetta Macaro from Canada. They say, thanks for the great presentation. And based on your deep knowledge of Nigeria and how change happens or does not happen, what is required to get changes in policies in their implementation? What are the drivers of change? Is it about more and more accurate data? Is it about more and sustained advocacy or pressure from, I guess, women's rights organizations or civil society organizations, or something else? And I'd love to hear from each of the panelists on this question from your perspective. What is really required? Patience, please go ahead.
Okay, I think looking at what she had listed, it's a combination of all this. To start with, accurate data. Getting accurate data, sex disaggregated data is quite important. And then also sustained advocacy, not just starting it, hitting the ground running, and at some point it withers off. So there must be sustained advocacy and pressure as well from women rights organizations to ensure that the government actually see the need to put in whatever they are doing in the gender context.
Thanks, Patience. Hung Lee, can I hand it over to you next?
Advocacy is really important because I believe a lot of policymakers act when there is public pressure and when there is a political cost to not acting. So it's crucial for civil society to organize and to exert pressure on the government, and to also ensure that issues around gender are highlighted in the media.
Thanks. And Amy?
So, our government is, I don't know about many people, but in Nigeria, there's a shrinking civic space for It's shrinking, it's shifting, it's changing, it's volatile sometimes, it's good sometimes, it's a continuous flux. And so while data is critical, it's important that we have a government that understands data, that appreciates data, and that uses data. So one of the things that we saw is in Lagos State, for example, when we showed our findings, they had their own data, and how they got their data, don't ask me, but they had their own data, but they were a very engaging government to say, oh, we are open to hearing. So there's a platform. So to answer your question, it is, yes, data and combination of increased pressure. So now what's happening is COVID-19, the worst is over, no more lockdowns. And so there's a release now of, oh, let's go to other things. Election is coming in a year or so, everybody's focused on that. There's something else, climate change. So, but it is about getting them to understand how to mainstream many of these issues that we're speaking about. A critical issue of gender equality is to get always on the forefront and getting them to make it in ways that work. It's not an add-on, it's a necessity for us to have in our work, in our plans. It's not something, it's not an afterthought. And obviously, women and human rights organizations, civil society have always been at the fore, will always be at the fore, but they need support. So I would add that to say, yes, while they are very good in putting pressure and advocating and also implementing projects themselves and supporting beneficiaries, they themselves need mental health support. They need funding, long-term funding. I cannot stress that enough. And they just need an enabling environment to do their work better. So it's a combo of that, all of that.
Thanks. Elizabeth has another comment. She says, please keep stressing that. So we got two more questions in only 2 minutes, but this question was kind of addressed already, but just in case others have joined us a little later on. It comes from Ade Damola Ailade. What are your recommendations for stemming the disproportionate cases and deaths among men? So Hung Lee, I know you sort of addressed this question a little bit, but I'm going to throw it back to you very briefly to address that. And then Amy, I'm going to have the last question for you.
We need to have targeted health promotion programs and campaigns for men to encourage preventive behaviors such as face mask wearing, social distancing, as well as to encourage early testing and treatment. And we don't have data on the gender differences in vaccine uptake. But if there is a disparity, then we also need to push for vaccinations among men who are vulnerable to infection and deaths.
Thanks, Hung Lee. And Amy, last question. Do you plan any more publications on COVID-19 in Nigeria? What are your future plans?
Oh, yes, definitely, yes, a lot, because part of our findings, we had several thematic areas. One of the places that we looked at was the impact of COVID-19 on women and men, but women with disabilities. And so evidence download, we have it on the Gender and COVID-19 project website. So I encourage everyone to go there. It's not there yet, but it should be there just before December 3rd or 4th, which is the International Day of Persons with Disability. There are other publications that we hope to have, briefs, if you will, just short briefs regarding all the thematic areas that we found. So one particularly with women in the informal market, in the informal space, evidence download around that. And then another one with social networks. What happened? How did the COVID-19 impact social networks? One of the things that we found was, while government gave their palliatives, was a lot of, there were people relied on family, on friends, on employers to provide support. So we wanted to interrogate that and take a stronger look. We have some publications that will do a comparison with Kenya, because this study was not just for Nigeria, it was for Kenya, Bangladesh, Nigeria, UK, Canada. Rosemary, remind me of the other countries, but we want to do sort of a comparison to see how countries, particularly Kenya and Nigeria, fared in terms of the pandemic and gender. So to answer that question, there are a lot more publications. I encourage you to join the working group. I also encourage you to go to the COVID-19 website, where not just for Nigeria, but for other countries are listed. You will find helpful resources, particularly the gender plan and other briefs. So please use that.
Thank you so much. And thank you, Patience. Thank you, Hung Lee. Thank you, Amy, for coming today and sharing your insights and your experience. And thank you all for attending this webinar. The recording will be available on the website, and we will look forward to sharing future publications with you. Have a great rest of your day, everybody. And thanks again for joining us.
Thank you so much.
Yeah.
Pleasure. Thank you, everyone. Thank you.
Thank you.
Thank you.